Hey folks, welcome to DocTalk. We're going to have a great show today. We have Dr. Matt Miesner joining us, and we're going to talk about some things coming up on this show season. We're going to talk about ringworm and warts and different things that can grow on the skin of cattle. Stay tuned after these messages to listen more from Dr. Miesner.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com. This segment brought to you by Kansas Regenerative Medicine. Your stem cells, your health, your life.
Matt, welcome to the show.
Glad to be here again.
Folks, this is Dr. Matt Miesner. He's an associate professor here in our Veterinary Health Center at Kansas State University, where he sees a lot of animals. He's one of our medicine and surgery specialists here for beef cattle. Spend a lot of time down in the clinics.
Yeah. In fact, you managed to get me to come back here.
We kind of had to snag him away from a case, actually, leading right into what we're doing today. And we're going to talk about warts and ringworm, but we thought we'd start out by talking about some wart issues. And I didn't realize there's so many different types of warts.
Yeah, I think that people researching these kind of things in cattle, we see everybody thinks, well, I got warts, and but the research showing they get up to 15, 16 different strains of just bovine-specific papillomavirus or types of virus that causes warts in cattle. So a lot of them, and so they're not all created equal, that's for sure.
And you're talking about you can get them all kinds of different places.
Sure, and so each of those strains generally have a specific area they like to grow in, and so you got a bunch of different skin types, which we're used to seeing these big old giant tumors looking on cattle. Some that are specific for the reproductive tract, the penis on bulls, the reproductive areas on cows. We've got areas that tend to like to form in the esophagus and the intestines, you name it. And so each of those strains kind of wants to go to a certain area.
Okay. And then can you, I mean, obviously based on the placement of them, but then can you send them in and get diagnostics on them or things to that nature?
So, I mean, I think that it's pretty, when you see a wart, it's pretty predictable as to what it is. You know, we don't necessarily need a biopsy to prove that it's a wart. What we see is sometimes more of the clinical problems with those types of things, and so they can get out of hand, or they can cause bleeding in certain areas, especially the reproductive tract, that hinders sterility in bulls if you've got blood in your semen with that kind of thing. So we don't really need to necessarily biopsy to prove it, but certainly there's some things that it could be, and so occasionally we'll look at them and maybe this wart is characteristic of some other type of a tumor, and so we may want to, but most oftentimes warts are pretty predictable.
You mentioned that these are caused by viruses, papillomavirus, and so it lends me, we have pretty good vaccines against viruses. Can we have vaccines against warts?
Yes, and there is at least one licensed vaccine against warts. And when I mentioned there's so many different strains of that wart, this vaccine tries to incorporate as many types as possible. And actually the company will solicit submissions from veterinarians or producers to try to get more strains, okay? So this is only one that does it. It tries to encompass all of these, and so as vaccines would be, sometimes it's effective, sometimes it's not, but that's about the only way to truly get some sort of immunity against the virus.
And you said that's in Colorado?
Well, the company is Colorado Serum Company, and I'd have to remember where it's from, but that's the one vaccine that I know of.
Cool. Well, many different types of warts. Best prevention is going to be a vaccine, Colorado Serum Company. We're going to come back a little bit and talk with Dr. Miesner about how we're going to treat cattle, how long it takes for the clinical signs to go away or for the warts to be gone. Thanks for watching DocTalk. More after these messages.
Buying a car shouldn't be this hard. And at Brown Chevrolet Buick in Wamego, it isn't. It's actually awesome. Whether you want a new or used car or truck, Toby's team can make the deal. Even if you want to custom order a new car or truck, Toby's team can make the deal. See Toby's team at Brown Chevrolet Buick in Wamego. We're awesome. Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
Watch Ag AM in Kansas online at agaminkansas.com. This segment is brought to you by Santa Fe Trail Meats in Overbrook, or visit us online at sftmeats.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Matt Miesner. We're from Kansas State University's College of Veterinary Medicine, where Dr. Miesner is an associate professor in the Department of Clinical Sciences, and he's also our section leader for our livestock services section.
Yeah.
Changed the name.
Yeah, we did.
No more ag practices now. We got livestock services. But basically, he is an internal medicine specialist that sees a lot of cases here, a lot of cattle coming through our clinic, specialty cases, regular cases, and we're talking about warts. So, you know, we get a calf in here and, you know, it's fair time or whatever, and someone comes in and says, oh, shoot, I got a wart I need to get rid of. What are we going to do?
And there's probably, kind of to that, there's several reasons that we'll see it. One would be show season, 4-H season, and warts on the skin are going to be one of those things that don't allow you to go into the fair, because it is a virus, it is a contagious virus, it is one of those things that they don't want to have there. Not only is it unsightly, but it's one thing. So that'd probably be one of the reasons we'd see it. And so if you think you've got warts, or you know you've got some on these, you're wanting to plan ahead to get rid of them at least a month before you go. And as we have for prevention, meaning a vaccine against a virus, the way that we treat these is to try to remove them. And sometimes it's a matter of just surgically removing them. We freeze them, we burn them off, we do a whole bunch of things, and we leave a little wart. And that being that it's supposed to stimulate the immune system to fight off anything else.
So it's kind of like a natural vaccine then. Right. You irritate it, the viruses get an immune response, and then it prevents others from forming and then also attacking the
ones that are there. Yeah, so you're hoping that you're internally stimulating the immune system to fight it off. And but it takes time, you know, so we can remove it. We're going to have some wounds that need to heal, but we're also going to have to take time to let the body heal those up.
Yeah, so at least a month ahead of the fair or wherever you're going to show that animal, we need to get after it and try to get it done.
That's for skin ones.
Now, penile warts.
So penile warts, bulls, reproductive exam, breeding soundness exams in the spring. Very common to notice warts in young bulls. Most of them will resolve on their own as their immunity develops. Okay, but if they test a bull and they see a wart, certainly anything on that wart when he tries to breed could cause bleeding. Bleeding's not going to allow him to have a successful pregnancy, because that's going to hinder it. So then we'll possibly talk about taking that wart off if it doesn't go away on its own. And again, planning ahead. We usually try to take these off, remove the wart, check them 2 weeks, make sure it's gone. Okay, some of them are really persistent and they don't want to go away. So a lot of times, you know, we'll see these that we have to treat multiple times, you know, before they go. And but again, planning for at least a month ahead to get this stuff cleared up. 60 days prior to, or at least a month prior to breeding season, this thing needs to be cleared up, you know, and those kind of things.
So, and you probably take those off the same way, excise them or freeze them?
Surgery, freezing, we do some laser therapy in the clinic, you know, so some of those kind of things. And so there's multiple ways to try, and depending on the strain, sometimes they're a little difficult to get gone, so we need to plan ahead.
Ever vaccinate in the face of already having warts?
Yep. We do that too, you know, just trying to see if we can stimulate it, but usually that strain is going to be fairly specific.
Cool.
Yeah.
Well, let's take a break, and then we'll switch gears to something a little more itchy.
Sure.
Ringworm. Folks, thanks for watching DocTalk. Dr. Matt Miesner, Dr. Dan Thomson. More after these messages.
To see this show and past episodes of Ag AM in Kansas, go online to agaminkansas.com. Soil is the life of a farm, and for 25 years, SureCrop Liquid Crop Nutrition has helped growers produce abundant quality crops while preserving and improving the soils they steward. SureCrop offers complete soil and plant analysis with cropping recommendations, delivery direct to your on-farm storage, and quality crop nutrition custom blended for your field. Choose SureCrop for the assurance of excellence for your soil. Call today or visit their website for more information.
I will take action against herbicide-resistant weeds. I will know my weeds, and I will stop them before they go to seed. I will do whatever it takes to give my crops the upper hand, and I will use multiple herbicide sites of action because every action counts. I will take action, this time for all time.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica, Inc.
Howdy, I'm Kurt Pate from Rygate, Montana, with your Beef Quality Assurance Tip of the Day. When we're handling livestock, I think it's important to remember that we have three kinds of pressure. We have a driving pressure, we have a drawing pressure, and a maintaining pressure. If we apply pressure properly, when we do whatever job we're going to do, it will put the animal in the position we want to put it in the right frame of mind. And for beef quality assurance, if the animal is calm and ready to be worked, that's the right thing to do.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
The new Better Horses Network is worldwide. Presented by Lucas Oil. Featuring worldwide radio and TV with iconic hosts like Al Dunning, Sharon Camarillo, Ernie Rodina, Lindy Birch, and Craig Cameron. With American Cowboy, Horse and Rider, Brushy Creek, Cavenders, and Ride TV. Worldwide radio and TV. The all-new Better Horses Network.
Support Kansas agriculture education with an AgriTag. AgriTags are available anytime at your county treasurer. They look great on cars and trucks. For more information, go online to ksagclassroom.org.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment brought to you by Kansas Soybean Commission. Progress powered by Kansas farmers.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Matt Miesner, who is an associate professor and the section head of livestock services, our practice here at Kansas State University's College of Veterinary Medicine. Does a lot of work teaching, is nationally acclaimed, and does a lot of speaking out there at veterinary meetings. Glad to have you on the show. Grab you out of right when he's heading out of the clinics in the truck to go work on a case. Said, hey, you mind shooting this real quick? But anyway, ringworm.
Yeah, another fun one. And I apologize. Yeah, I didn't have time to go through makeup and hair today, so not a big deal. Ringworm's another one of those skin problems. And when we talked a little bit in the past about warts, and ringworm gets a name of worm, but it's actually a fungus. Okay, and it can sometimes look like warts because sometimes it gets kind of a crusty surface to it, you know. So, but ringworm is actually not a worm; it's a fungus, and it's a contagious fungus. It's another one of those skin things that'll keep you out of the fair because they don't want to have that type of a contaminant in the environment or on other animals to create other problems.
Mainly contagious cattle to cattle, but there could be some issues, you know, where it could be zoonotic, right? Or from cattle to people.
Yeah, so sure. I mean, it can go from critter to critter, from critter to post to critter. It can go critter to ewe to critter, and it can go, some species of ringworm in animals can be transmitted to people to cause clinical problems, some severe itching and other things. And some people are more susceptible to it than others. But ringworm, some of this are, again, a bunch of different species of ringworm, and a lot of them are species specific. In cows, generally get cow types, and goats and cats, but some of those species are certainly zoonotic to you too.
I've had clients come in and had ringworm on a cat, and then you look at their arms, and it's on their arms or wherever they're holding that cat.
Yeah, just
be careful.
Yeah, it's not pretty.
And then you said there's no vaccines for this.
Right. So unlike the warts or other skin things where we've got a typical virus, a fungal type situations like this, there's really no preventive mechanism like a vaccine for it. It's one of those things, you either clear it or we treat it and take care of it.
So they're picking it up where?
In the environment. And so again, usually it's an animal that's had it, they're carrying it, they're contaminating the environment with it, and it can reside in various areas. As long as it's in the right environment, it can last, and an animal can rub up against a post or a gate or anything and manage to get it in that situation too.
So we're going to look at prevention basically is going to be, if you have an animal, you're going to isolate it, and then the rest of it's taking care of the environment and making sure that we get it cleaned up.
Sure. Yeah, you'd want to, a lot of areas will be self-cleaning and get sunlight and those kind of things, but moist, dark areas and a bunch of crevices can hold it, and then you got to be careful with that kind of a thing.
You think about some of the show cattle that we keep inside or keep them in cooler boxes, things of that nature. You might want to disinfect or scrub down those cooler boxes.
Right. Yeah. Yeah. Those kind of things. And then again, be careful with on those, but moist, dark areas, and
wear gloves.
Wear gloves.
All right. Let's take a break. Folks, you're watching DocTalk. Dr. Matt Miesner here. When we come back, we're going to talk about how to treat ringworm after these messages.
I had this horse. It was a good horse, except for when the wind was blowing above 30 miles an hour. Wind was blowing about 35, 40, and I saddled him up, rode him out to the end of the lane, and I thought, well, he's doing pretty good. And about 6 jumps later, I was laying on the ground and thinking, boy, my shoulders sure hurt. I kept waiting, and it didn't get better, and so I went to an orthopedic surgeon, and that showed that I had torn rotator cuff. And said, well, we'll have to do surgery. I thought, I farm and ranch by myself. This is not going to work out very well. I'd been sleeping in my recliner for about 2.5 years because it hurt too much to sleep in bed on my side. And I'd heard about Kansas Regenerative Medicine Center on the radio, and gotten down there at 8 o'clock in the morning, and by 11:30 the procedure was all over. They just took some fat out of my side here and spun that down for about 45 minutes and then injected it in my shoulders, and I was on my way. It's something you don't hear about, but I thought it was worth a try, and I'm really pleased. It's really worked out well for me.
Healthy cows start with the new Hired Hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher, leaving more time to tend to other vital tasks on the farm. To learn more, visit cowsprayer.com. The new Hired Hand makes healthy cows easy.
When your living depends on agriculture, you can depend on KFRM 550 AM. If you're in the southwest 3/4 of Kansas or the northern half of Oklahoma, catch us at 550 AM on the radio dial. But if that isn't you, listen on your cell phone at TuneIn Radio or on your computer at KFRM.com. We promise to keep you informed, entertained, and company as you go through your day. KFRM 550 AM, the voice of the plains. We would like to join your management team.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Jim Coffey grew up in Prairie Grove, Arkansas, just outside of Fayetteville, on a small sheep and dairy goat farm. Since childhood, Jim has always had an affinity for animals, especially large animal production with cattle and small ruminants. After graduation, he'll be heading off to Disneyland. But after that, he plans to join a mixed animal practice in
Ag Promo Source is a unique group of marketing specialists with one mission: help your ag business grow. Each affiliate has their own area of expertise, and they work together to bring you advice, products, and services. To get started, visit agpromosource.com. Ag Promo Source. Together we grow.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net.
This segment brought to you by Kansas Farm Bureau, the voice of agriculture. To join today or more information, go to kfb.org or find us on Facebook and Twitter.
Hey folks, welcome back to Doc Talk. I'm here with Dr. Matt Miesner, who's an associate professor in the Department of Clinical Sciences and the section head of the Livestock Veterinary Services here at Kansas State's Veterinary Health Center. We're talking about ringworm and the fungus among us, and you know, when we get dogs and cats and people, you know, we can use some not just topical things, but we can actually treat them with antifungals, systemic antifungals, and that we don't do that much in beef cattle.
Don't do it much in cattle, and the reason being is it's fairly expensive. Being ruminants, it's hard to get the volume that you'd want into them to be effective against treating these kind of things, and so in almost all situations, it's not really practical, and we don't even really know how effective it is in some of these to give a drug like greaseafulvin is the drug that a lot of people would get, or a cat might get, or something, but not going to be something that we pick off the shelf really readily.
And we're eating these animals.
Yeah.
And so,
right.
you know, withdrawals and things like that, and some of these products, but so when you start to think about, well, I'll go get my veterinarian to give me something that's internal that we had a cat and we gave it this and it dried it up, probably not going to be the same. And lot different decision process in that, and not just cost, you know. So again, effective, cost, withdrawal times, those kind of things. So systemic treatment is pretty unlikely, and that's really, some of those drugs are really the only ones that are proven. You know, there's some theoretical treatments with iodides and iodines and other treatments that have really not been proven, certainly have their own side effects that have been attempted, but really not proven. The only things that you can really do for these are treat them topically, clean them, betadine type things, and sun drying. You know, there's been a bunch of witch magic out there with flower treatments. I'm not going to mention names on these because it's not right, but there's been some things that diesel solvents and a bunch of different things to try to dry these out that have been tried, again not proven, and maybe more irritating than good. But there's a bunch of ringworm it creates a bunch of desperation because it's a hard one to get rid of, and so. And I think that, you know, the other thing is, as you mentioned earlier, fungus or ringworm in humans versus cats versus dog and cattle can all be different.
Yeah.
And so trying to buy all over-the-counter stuff for humans isn't going to probably work on cattle. Again, getting back to iodine, scrub, cleaning it, and getting it out in the sunshine and drying them out.
Yeah.
A lot of them self-resolve.
Yeah, a lot of them will clear up on their own. And I think a lot of it has to do with the individual's immune system. You know, some people are more susceptible to it. Some cattle are having trouble getting rid of it, and it has to do with just some of their immunity or ability to fight it off on their own. And so that's something we kind of keep in the back of our mind as well.
Wow. It's been a great show. I always appreciate you coming on and spending time with us. And, you know, anything else on ringworm or warts or?
No, I mean, yeah, it's frustrating, and I feel the pain of the producer a lot of times when we're trying to get these things cleared up, and it's just it can be a lot of work to get them gone.
Make sure you plan ahead. Make sure you work with your local practitioner. And if you want to know more about what we do on DocTalk, you can find us at www.doctalktv.com. I'm Dr. Dan Thomson, here with Dr. Matt Miesner. We're at Kansas State University's College of Veterinary Medicine, and we'll see you down the road.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com.